When you get vaccinated for pertussis, you're doing more than protecting your own health. You're helping to protect the health of your child. Claudia Solis-Alcala explains how an immunization for you and your entire family is the best form of prevention.
18-month-old Sophia Felix and mom Justina are visiting the Fresno County Department of Public Health to get Sophia's final dose in the series of childhood immunizations, which helps to prevent pertussis. According to Dr. Edward Moreno, Sophia is now protected from the bacterial respiratory infection which causes severe cough and cold symptoms.
The best way to prevent pertussis is through vaccination.
Pertussis is highly contagious during the first weeks of infection. A simple sneeze or cough can spread the illness. Mom understands the need to keep Sophia healthy, especially since whooping cough restricts breathing and can be fatal for infants.
To not see her healthy and to see her suffering and in pain would definitely be devastating for me. And just knowing that it could get to the point where she could cough so hard that she wouldn't be able to breathe.
The vaccine Sophia just got is like other vaccines in that it contains very small amounts of the weakened or dead germ that causes the disease. Vaccines teach the immune system how to recognize and fight the infection before it happens. This small sample of the germ helps the body develop a resistance.
The reason why immunization is so effective at preventing pertussis is that pertussis is a bacteria that persists among the population. And if we can, the more people we can immunize, then the pertussis bacteria has less chance of causing infection.
The childhood series of vaccinations involves 5 doses. They are given at 2 months, 4 months, and 6 months, again between 15 months, and finally between 4 to 6 years.
And that's important because the infants less than 6 months of age have the highest rate of pertussis, and once they get pertussis, they have the highest rate of hospitalization, pneumonia, and death. So we start the vaccines early.
75% of babies contract pertussis from a household member. So, mom, dad, siblings, grandparents, and any caregivers need to be immunized. This also includes pregnant women. It can be given before pregnancy, into the 2nd or 3rd trimester, or immediately after delivery.
And the mother with a newborn might get infected and cough on the newborn, and the newborn will come down with pertussis.
Dr. Moreno says pertussis rates peak every 3 to 5 years because, after several years, a person's immunity to pertussis wears off.
And pertussis, when it's given the opportunity, will start to spread in a community when there are enough people in the community that aren't immunized.
Before pertussis immunizations were available, nearly all children developed whooping cough. In the U.S., between 150,000 and 260,000 cases of pertussis were reported each year. Though rates now are much lower, the risk still exists. From 2000 to 2008, 181 people died from pertussis. Of these, 166 were less than 6 months old. This is why Justina keeps Sophia up to date on all of her immunizations, especially whooping cough.
For me, the key is prevention. Why wait to the point where she could potentially get sick? If I can avoid it by getting her immunized, then I'm definitely for it, and definitely will do it over and over, to make sure she's safe.
I'm Claudia Solis-Alcala for 0 to 5 in 30 minutes.
Thanks, Claudia. And for more information on pertussis or whooping cough immunizations from the Fresno County Department of Public Health, call 559-445-3200. Or you can visit us online. We also have contact information for the Tulare County Health and Human Services Agency. Just go to valleypbs.org and click on 0 to 5 in 30 minutes.
This program funded in part by First 5 Fresno County. At First 5, we focus on the first 5 years of life. We fund programs and services that better the lives of children in Fresno County.
Additional funding from First 5 Tulare County. Changing lives and building futures. Because it's all about the kids.